Monday Morning House Calls, sponsored by Appalachian Regional Healthcare.
Welcome back inside Mountain News this morning. Today we're being joined by Kimberly Long, and she is a registered nurse and program director at ARH Wound Care Center, and you guys are based in Harlan. So thank you so much for joining us this morning. Today we're talking about wound care. And, you know, first of all, Kimberly, can you explain to us what wound care is and when might someone need treatment?
Yes, we actually have several patients who come in with chronic wounds, and a chronic wound is basically a wound that's not healed on its own within like a 4-week time frame. So sometimes they require extra care. We see a lot of this in diabetics. They have chronic foot wounds and maybe a surgical wound, surgical infection, any type of wound infection that may require some specialized antibiotic treatment, some specialized dressings, and things that normally aren't required for a standard wound. Okay.
Now, you mentioned some open wounds, but there are some cases where open wounds may or may not exist. Can you kind of explain that for us?
Yes. Actually, we have cases of what's called osteomyelitis, and that's a bone infection where the bone can be infected and maybe just cause like a swelling of the joint or some pain, redness, fever. Also, crushing injuries can be internal, so we also can treat things like that in our hyperbaric oxygen chambers at the wound care center. So we do see some of those without an actual wound.
Okay, and so you mentioned one of the therapies or one of the treatments that you guys do there. Can you kind of explain to me some other therapies that you guys do?
We do everything from a standard wound care, silver dressings, and wound vac therapy, which is a negative pressure therapy that kind of pulls the wound and heals from the inside out. And we also go to the hyperbaric oxygen chambers, which is for qualified diagnosis diabetic foot ulcers, which is a really advanced therapy that we're glad to have here in Southeast Kentucky. And you treat them with 100% oxygen, they breathe it, and it carries that to the wound bed, which enhances healing, makes it heal faster and better.
Okay, and you know, you mentioned diabetes. There's a lot of people, especially out here in the mountains, that have diabetes. If someone, maybe they are diabetic or maybe they think that they might need wound care, maybe their doctor recommends it, how would they go about getting this type of treatment?
It's really easy. At the wound care center we have in Harlan, you do not even have to have a doctor's referral. You can pick up that phone and call us yourself, schedule an appointment. We have doctors available in the clinic at all times to assess your feet, check your wound, any type of wound. Any type of wound you have and you're concerned, you can just they can pick up the phone and call themselves. They can discuss it with their doctor, but don't even have to have that referral.
Okay, so lots of useful information. Yeah. Thank you so much, Kimberly.
Thank you.
And Chef Walter is next.